More than 7 out of 10 pancreatic cancer cases are diagnosed after age 65. Not because seniors complain too much, not because every stomach problem is cancer, but because the warning signs can look like ordinary aging, ordinary indigestion, ordinary back pain, or ordinary blood sugar trouble. And that is exactly what makes this so dangerous. You can be doing what many people do right now, brushing off a change in your body as nothing serious, when your body is quietly asking for attention. This matters even more, because pancreatic cancer is often hard to spot early. In U.S. cancer data, only a small share is found, while still just in the pancreas, and outcomes are far better when it is caught before it spreads. So this video is not here to scare you. It is here to help you notice what should never be ignored, especially if you are over 60, especially if something feels new, unusual, or just not normal for you. The Mayo Clinic, the American Cancer Society, and the National Cancer Institute all describe the same troubling pattern. Early pancreatic cancer may cause no clear symptoms at all. Then, when symptoms do show up, they often look like common problems people explain away. That is why today, I want to walk with you through 8 warning signs seniors should never overlook. In plain English, slowly, clearly, and honestly. And if this channel helps you protect your health, please subscribe. It helps this information reach more older adults who may need it right now. And let me know your age and where you are watching from in the comments. I always like seeing how many people in their 60s, 70s, and 80s are taking their health seriously together. Warning sign number 1 is yellowing of the eyes or skin, called jaundice. Jaundice means the whites of your eyes start to look yellow, or your skin takes on a yellow tint. This is one of the most important warning signs because pancreatic cancer near the head of the pancreas can block the bile duct. The bile duct is the little tube that carries bile from the liver into the intestine. Bile is the fluid that helps your body digest fats. Think of it like a kitchen sink drain. If the pipe gets pinched, the fluid cannot flow where it is supposed to go. It backs up. In your body, that backup can raise a yellow substance called bilirubin in the blood. Bilirubin is what makes the eyes and skin turn yellow. Now here is the mistake many people make. They think, maybe it is something I ate. Maybe it is my liver medicine. Maybe the bathroom light is making me look odd. Or they notice it in a loved one and decide to wait a few days. Please do not do that. Yellowing of the eyes is not a watch and see for a month symptom. It needs prompt medical attention. The fix is simple, and it does not require equipment. Look carefully in the mirror in natural light. If your eyes or skin look yellow, call your doctor urgently. If it happens quickly, or you also feel very unwell, seek urgent care. And when you call, do not just say, I feel off. Say clearly, my eyes look yellow, because that changes how seriously the symptom is triaged. A lot of people think jaundice always comes with severe pain. It does not. Sometimes it arrives quietly. A daughter notices it over coffee. A spouse sees it when the bathroom light hits just right. A friend says, you don't look like yourself today. Those small moments matter. And tell me in the comments, do you think people are warned enough about yellow eyes being an urgent symptom? I have a feeling half of you will say yes, and the other half will say not nearly enough. Warning sign number 2 is dark urine, pale or greasy stools, and itchy skin. I am grouping these together because they are often part of the same traffic jam. When bile cannot flow into the intestines the way it should, your stool may lose its normal brown color and become pale, gray, or clay-colored. It may also become greasy or float because fat is not being broken down properly. At the same time, your urine may turn darker, sometimes tea-colored or brown, and your skin may itch, sometimes before the yellowing becomes obvious. Here is the why. If bile is like dish soap for fat, your intestine needs that soap to break greasy foods apart. When the soap never arrives, the body cannot handle fat normally. Meanwhile, some of the pigment that should have gone into the stool ends up affecting the urine and the skin instead. The common mistake is calling this just a stomach bug, just dehydration, or just getting older. Many older adults also feel embarrassed talking about stool changes, so they stay quiet. But your stool is one of the clearest report cards your body gives you. If it suddenly changes color, texture, or buoyancy, and stays that way, it deserves attention. The fix is to stop guessing and start observing. Notice if the stool is consistently pale, greasy, or floating. Notice if urine is unusually dark even when you are drinking normally. Notice if itching is widespread and hard to explain. Write those changes down. Then tell your doctor exactly what changed and when it started. Specific details help. My stool has been pale for 2 weeks is far more useful than my stomach feels weird. I once knew of a very typical story. A man in his early 70s thought his dark urine meant he needed more water. His wife thought the itching was dry winter skin. Only later did they connect the dots, when his eyes began to yellow. That is how these signs can sneak past you. Not because you are careless, because they imitate ordinary things. Warning sign number 3 is pain in the upper belly, or pain that spreads into the back. This is one of the most commonly dismissed signs in older adults. Why? Because back pain is common, belly discomfort is common, gas is common, arthritis is common. But sometimes, the pattern is what matters. The pancreas sits deep in the upper abdomen, tucked behind the stomach. It is almost like a hidden switchboard in the back of the kitchen wall. If a tumor grows there, it can press on nearby organs, or on nerves, and that pain may be felt in the upper middle belly, the upper back, or both. Some people say it feels worse after eating. Some say it is worse when lying flat, and better when leaning forward. That last detail matters. If a pain changes with meals, posture, or both, do not just assume it is age. The body is giving you clues. The mistake people make is saying, I must have slept wrong, or it is just my spine, or I lifted groceries. Sometimes that is true. But when the pain is persistent, unfamiliar, or paired with weight loss, appetite loss, nausea, or stool changes, it deserves more than a heating pad and hope. The fix is not to panic. It is to pattern match. Ask yourself, is this new for me? Does it keep returning? Does it feel deeper than muscle pain? Is it tied to meals? Does leaning forward help? Then bring that pattern to your doctor. Here is a comment debate for you. Do you think back pain is too easily dismissed in people over 60? I know this one will split the room. Some of you will say, back pain is almost always harmless. Others will say that is exactly why serious causes get missed. I would love to hear both sides. Warning sign number 4 is unexplained weight loss or a sudden drop in appetite. And this one can fool people badly, because some people are pleased at first. Their pants fit better. Their face looks slimmer. Friends say, you look great. But if you are not trying to lose weight, your body does not usually shed pounds for no reason. With pancreatic cancer, weight loss can happen for more than one reason. You may eat less because you feel full, nauseated, or uncomfortable. Your digestion may be disrupted, especially with fats. And cancer itself can change the way the body uses energy, almost like a furnace burning fuel too fast, while the house still feels cold. That is why unexplained weight loss is different from healthy weight loss. Healthy weight loss usually has a clear reason. You changed what you eat. You moved more. You were trying. Unexplained weight loss feels like the body is shrinking without your permission. The mistake is celebrating it too soon. Many seniors think, well, I needed to lose a few pounds anyway. But when weight loss comes with weakness, poor appetite, new digestive problems, or pain, that is not a free gift. It is a message. The fix is to stop looking only at the scale and start looking at the whole picture. Are you eating less because you have no desire to eat? Are you full after just a few bites? Are you losing weight while also feeling tired or unwell? Are your clothes hanging differently, even though you made no effort to slim down? If yes, tell your doctor clearly, I am losing weight without trying. Some of you may disagree with this next sentence, and that is okay. After 60, unplanned weight loss should never be brushed off as probably a good thing until you know why. Tell me in the comments if you agree or disagree. I really want to hear how you see it. Warning sign number 5 is a new diagnosis of diabetes, or diabetes that suddenly becomes harder to control, especially when it appears with weight loss. This one surprises people. They think pancreatic cancer is a stomach disease, so why would blood sugar be involved? The answer is because your pancreas helps make insulin. Insulin is the hormone that helps move sugar from your blood into your cells, where it can be used for energy. Imagine insulin as a key. Its job is to unlock the door so sugar can get inside the cell. If the pancreas is under stress, damaged, or affected by a tumor, that whole key and lock system can start to fail. Blood sugar rises, diabetes may appear, or long stable diabetes can become oddly difficult to manage. Now, to be very clear, most people who develop diabetes do not have pancreatic cancer. And many people with diabetes never will. But when diabetes shows up later in life and is paired with weight loss, appetite loss, belly or back pain, or jaundice. That combination deserves attention. The mistake is to focus only on the sugar number and ignore the rest of the story. A person hears, "You have diabetes," and thinks that explains everything. But sometimes diabetes is not the whole story. Sometimes it is one chapter in a larger story. The fix is to look for unusual patterns. Did blood sugar trouble seem to appear out of nowhere? Is it getting harder to control despite doing your usual routine? Are you also losing weight without trying? Bring the whole cluster of symptoms to your clinician, not just the glucose reading. This reminds me of a fictional but very realistic patient I will call Linda. Linda was 72. She had always been careful with food. She walked most days. Then, over a few months, her blood sugar started climbing. At first she thought, well, I am getting older. Then, she began eating less, because meals sat heavy in her stomach. She lost weight, but not in a healthy way. Her daughter noticed her urine looked dark when she stayed at her house. Linda also had a dull ache under her ribs that wrapped around to her back. What scared Linda most was not the pain, it was the uncertainty. She told her doctor it felt like several small things, none of them dramatic, but together, they were not normal for her. That honesty mattered. She was evaluated, and the cause turned out to be serious. It was not a miracle story. She needed real treatment, and the road was hard. But because she did not keep waiting, her team had options. Her jaundice was relieved. Her symptoms improved. Her condition was managed sooner than it would have been if she had kept saying, "I'll give it another month." That is the lesson. Not every symptom means cancer. But delaying because each symptom seems small can be dangerous. Warning sign number 6 is nausea, vomiting, bloating, or feeling overly full after eating. This can sound ordinary, because almost everyone has had indigestion, but pancreatic problems can sometimes partly block the normal flow of food out of the stomach, especially if a growth is pressing on nearby structures. Think of your digestive tract like a hallway. Food is supposed to move through it smoothly. If a section of that hallway gets narrowed, traffic backs up. You may feel sick after meals. You may feel stuffed too quickly. You may burp more, bloat more, or even vomit. The mistake is assuming every digestive complaint is just reflux, just heartburn, or just something I ate. Again, sometimes that is all it is, but a new digestive pattern that lingers, especially when it comes with weight loss or pain, should not be put on endless repeat with antacids alone. The fix is to pay attention to timing and persistence. Does the nausea happen after meals? Does eating make the back pain worse? Are you getting full after just a little food? Have you had more than a brief stomach upset and it is not improving? Those details matter. A relatable moment here is the older adult who starts quietly skipping dinner, not because they are dieting, but because eating has become work. They nibble crackers. They push food around the plate. Family assumes they are just not hungry, but the body may be saying much more than that. Warning sign number 7 is unusual tiredness or weakness. Now, I know this one is tricky. Fatigue is common, poor sleep is common, stress is common, aging can bring less energy. So why mention it? Because fatigue that feels different, deeper, or paired with other red flags can be meaningful. The American Cancer Society and Mayo Clinic both include tiredness or weakness on their symptom lists. Why can this happen? Several reasons. The body may be under strain. Nutrition may be poorer because eating is harder. Digestion may be less effective. Sleep may be disturbed by pain or itching. In simple terms, it is like trying to run your house on a weak battery while several appliances are malfunctioning at once. The mistake is telling yourself, "I'm tired because I'm old." I want to say this gently, but clearly. Aging can change energy. It should not automatically erase curiosity about a major change. If you used to have one kind of tired, and now you have a different kind of tired, pay attention. The fix is to ask better questions. Is this fatigue new? Is it out of proportion to what I did? Is it coming with appetite loss, yellowing, pain, digestive upset, or unexplained weight loss? If the answer is yes, do not reduce the whole picture to just age. And if you have ever had a symptom dismissed with the words, "That's just getting older," tell me in the comments. I think many people here have experienced that, and your story may help someone else feel less alone. Warning sign number 8 is a blood clot, especially pain, swelling, redness, or warmth in one leg, or sudden shortness of breath and chest pain if part of a clot travels to the lungs. This is one of the least expected warning signs, but it is real. In some cases, A blood clot is one of the first clues something serious is happening in the body. A blood clot in a deep vein is called a deep vein thrombosis. That simply means a clot in a larger vein, often in the leg. If a piece breaks loose and travels to the lungs, that is called a pulmonary embolism. That means a clot blocking blood flow in the lungs. Both can be dangerous. Here is a simple analogy. Healthy blood should flow like smooth traffic, but illness can sometimes make the blood more likely to clot, like cars suddenly bunching into a dangerous jam. Pancreatic cancer is not the most common reason for a blood clot. Far from it. But when a clot appears without a clear reason, especially with some of the other symptoms we have discussed, doctors should think broadly. The mistake is assuming a swollen, painful leg is just a pulled muscle, or that shortness of breath is just anxiety. The fix is urgent medical attention, not next month. Not after the weekend. Promptly. Now, let me say something important. None of these 8 signs, by themselves, automatically mean pancreatic cancer. Most of them are more often caused by something else. That is the honest truth. But pancreatic cancer is dangerous, partly because it borrows the mask of common problems. The issue is not one small symptom on one random day. The issue is a new symptom, or a symptom that persists, or several symptoms showing up together. So let's pull this together clearly, because repetition helps memory. First, yellowing of the eyes or skin, called jaundice. That is a red flag symptom, especially if it is new. Second, dark urine, pale or greasy stools, and itching. Those can happen when bile flow is blocked and digestion changes. Third, upper belly pain, or pain that spreads to the back, especially if it lingers, feels deep, or changes with eating or lying down. Fourth, unexplained weight loss or loss of appetite. If the pounds are dropping and you are not trying, do not just celebrate. Ask why. Fifth, new diabetes, or diabetes that is suddenly harder to control, especially when it comes with weight loss or digestive changes. Sixth, nausea, vomiting, bloating, or getting full very quickly after meals. That can signal a digestive traffic jam. Seventh, unusual fatigue or weakness. Not normal tiredness after a busy day, but a deeper change that arrives with other clues. And eighth, signs of a blood clot, like a swollen, painful leg or sudden chest symptoms. That one is urgent. If you remember nothing else, remember this. Do not isolate the clues. Connect them. Dark urine plus itching plus poor appetite. Back pain plus weight loss plus new diabetes. Nausea plus feeling full plus fatigue. The body often whispers in combinations before it ever screams. And there is one more reason this matters so much for seniors. The median age at diagnosis is around the early 70s.